Ankylosing spondylitis. Ankylosing spondylitis, or AS, is a form of arthritis. It causes pain and stiffness of the spine. The word ankylosing means rigid. In AS, the bones of the spine become very rigid. They can join or fuse together. The symptoms often begin in the lower back. They may also affect the hips and the rest of the spine. Other joints are not affected as often. Symptoms. The most common symptoms of AS are low back pain and stiffness. The symptoms feel worse after resting. They feel better after exercise or a hot bath or shower. The symptoms usually come and go, but slowly get worse over time. You may also have pain in the buttocks that shoots down into your thighs, stooped shoulders and trouble taking a deep breath, pain and stiffness in the hips, neck, knees, and feet, and fatigue and fever. Causes. The causes of AS are not known. Genes may play an important role. Most people with AS have a gene called HLA-B27, but some people with this gene do not get AS. Some people with AS do not have the gene. If you have the gene and you have a family member with AS, your chance of having AS is higher. Doctors think that the cause of AS may be a combination of genes and something in your lifetime, such as an infection that triggers AS to become active. Diagnosis. If your healthcare provider suspects you have AS, he or she will take a careful health history. You will also have a physical exam. You will likely have an X-ray of the spine. The doctor will look for signs of inflammation at the area where your spine meets your pelvis. This is called the sacroiliac joint. Your doctor will also look for at least one of these symptoms. Low back pain for at least 3 months that gets better with exercise but not with rest. Difficulty bending your spine side to side and front to back, or trouble expanding your chest with a deep breath. Your doctor may have you take blood tests. One is to see if you have the HLA-B27 gene. Another is to check for inflammation in the body. You may also need to have imaging tests done on your spine. Risk factors and complications. A family history of AS and having the HLA-B27 gene are the biggest risk factors. Being male is another risk factor. Men are found to have AS more often than women. Possible complications can include gradual stiffening of the spine, gradual stiffening of the chest wall, inflammation of the eyes, inflammatory bowel disease, weakening of the bones called osteoporosis, and depression. Treatment. There is no cure for AS, but several treatments can help. These include exercise to stretch the spine and posture exercises to keep the spine straight, non-steroidal anti-inflammatory drugs or NSAIDs for pain and stiffness, corticosteroid drugs to fight inflammation when symptoms flare, disease-modifying anti-rheumatic drugs or DMARDs if NSAIDs are not helping, tumor necrosis factor inhibitor drugs or TNF blockers, which are new drugs that may slow down the progression of AS. Other treatments may include surgery to replace or repair a joint, support and counseling, physical therapy, and occupational therapy. What to do? There is no way to prevent AS. Learning as much as you can about AS and working closely with your healthcare provider is the best way to maintain a normal posture and reduce pain and stiffness. If you have symptoms of AS, talk to your doctor. If you have been diagnosed with AS, here are some things you should do. Learn how to do your daily spinal and posture exercises. Quit smoking. Avoid slouching at all times. Practice deep breathing to maintain chest expansion. Make sure you have good back and neck support in bed. Make adjustments at work to protect your back. Maintain a healthy weight and a healthy diet. And seek help if you are struggling with depression. What we have learned. Ankylosing spondylitis is a form of arthritis that causes pain and stiffness of the spine. True or false? The answer is true. Inflammation of the eyes and depression are both possible complications of ankylosing spondylitis. True or false? The answer is true. There are no options for the treatment of ankylosing spondylitis. True or false? The answer is false. Posture exercises and corticosteroid drugs are just two of several treatment options.